Hi, this is Leonard again with another tele-tip of the month. Last month I did A-fib. This month I'm combining A-fib with RVR, just to kind of go over the bases again of A-fib. So A-fib is when the heart has an abnormal electrical pulse in the atrias. And looking at this diagram here, I have a picture of a heart. You have your right atrium and your left atrium that can have some fibrillation that's going on. And so these chambers can fibrillate or quiver rapidly, which can result in irregular pumping of the blood. And we've talked about how, with that being happening, this can cause some symptoms within itself, also chest pain. It can also cause some clots to form in those areas because the blood is not appropriately being pumped through. But with A-fib with RVR, we have rapid ventricular rate, which means the ventricles, you have the left and the right ventricles here that are now involved and now are fluttering. And when you have A-fib with RVR, you will experience some symptoms, typically rapid fluttering heartbeat. You also have some chest pain, some shortness of breath, some dizziness, and the patient may even pass out. So these are the patients we definitely want to be monitoring more closely. We put them on tele. We're doing our tele recalls, and we're monitoring them really closely for any of these signs and symptoms, because we do need to intervene when something like this occurs. So when these ventricles beat too rapidly, they don't fill completely and with blood, and as a result, the ventricles are no longer pumping blood effectively as they should be. So let's control the RVR, the rapid ventricular rate, and we want to also reduce the risk of blood clots. We want to make sure they're on appropriate blood thinners. We just want to follow with physicians there, and we want to control those symptoms of A-fib. Make sure the patient's comfortable. We may do this with the same medications as as beta blockers, calcium channel blockers, or digoxin. Thank you. This is my tele-tip for the month.